episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome, everybody, once again to another episode of our show, bringing you another fascinating guest today who is helping to create a better tomorrow for so many people. Today, we have the opportunity of being joined by Temitayo Erogbogbo, who is a Global Advocacy Director at MSD for Mothers Initiative, also known outside of the United States and Canada as Merck, and Dohme. Tayo has 2 decades of combined private sector and international development experience, 13 years of which he spent in the pharmaceutical industry in multiple roles across community relations, government affairs, marketing, and sales. As the Global Advocacy Director for MSD for Mothers, responsible for global and national strategic partnerships and programs to bring about policies and practice changes to improve maternal health care and ultimately strengthen health systems, particularly where private sector approaches can be leveraged for greater impact. Prior to MSD for Mothers, Tayo led the establishment of an adolescents and youth constituency at the Partnership for Maternal, Newborn, and Child Health, which was a multi-constituency partnership hosted by the World Health Organization, ultimately advocating for better sexual, reproductive, maternal, newborn, child, and adolescent health practices and services at global, regional, and national levels. In addition, at the time, he contributed to the development of the global strategy for women's, children's, and adolescents health care, 2016 to 2030 program. Previously, in collaboration with multi-sectoral partners in Nigeria, he contributed to the passage of the National Health Bill, the development of the National Gender Policy Guidelines, and the passage of violence against persons, prohibition and support of gender equality. Tayo also spearheaded Abbott's HIV patient relations function within Europe, developing various services to support people living with HIV by partnering with community organizations. He advocated for the antiretroviral drug access across Africa, developed healthcare professional training, train-the-trainer programs that has educated to date over 3,000 healthcare practitioners. Tayo earned his bachelor's in management sciences from Loughborough University and his master's in information technology from management from Coventry University. And aside from all that, he is also an accomplished athlete, having represented the UK in the triple jump, earning a bronze medal, European U23 Championships. A lot to talk about. All that being said, Tayo Erogbogbo, thank you so much for taking time to come on the show today.
No, a pleasure. Thank you very much for the invite.
Yeah, it's great having you. I'd love to start off just by handing you the floor for a little bit to talk a little bit more about yourself. If you could take us back a bit to every place from where you grew up, when you developed obviously your interest in advocacy and corporate sustainable responsibility, and ultimately a little bit of that early career journey. I think that'd be a great way to start things off.
Sure. So I was born in Nigeria. My family come from a town called Ikorodu in Lagos. But nonetheless, from the age of 10, I pretty much spent majority of the next 25 years in the United Kingdom, where I went to school to 2 great schools, one Beachborough, which is a prep school, boarding school. And then my secondary school spent as those school in Buckingham. And then spent university in the UK as well. I went to Loughborough, as you said, and then Coventry a few years later. But I mean, along with my education career or my education path, I spent, as you also mentioned, a good part of my early years in the UK as an athlete, which was a dear passion of mine. Sports generally, actually, not just athletics, was a passion of mine, both in terms of my school years as well as post school. So that's a bit about myself. In terms of my exposure to CSR and also advocacy, I'd say I'm in the 2 dimensions to this. The first is from a family perspective. My father was an industrialist and also at a construction company, was very successful. And it was always given, especially in an environment like Nigeria, where there's this huge disparities in terms of income and also I think from a cultural point of view, in terms of not just Yoruba culture, in terms of where I'm from, but also more broadly in terms of the society, we're always encouraged to give. And he was, I think, a great example of that. I particularly liked giving towards education. So he invested a lot in a number of people's education. Growing up, we always remembered various people that came to ask for support in that area. But also, I mean, in terms of sort of like a wider community where he had his business, as well as locally in Ikorodu as well. So I had very good exposure to that aspect of things in my early years. My mom would probably say that he gave too much to a fault, but I was extremely proud of him for doing so. And then from an advocacy point of view, I would say my passion in terms of advocacy really grew out of work in the HIV care within the pharmaceutical industry. I learned why advocacy really matters and the impact it can have in terms of transforming lives, both in terms of actual care for people, but actually just in terms of the quality of life and access to things that we take for granted. And I was privileged to work with some great individuals and organizations that were advocating for access to care, as well as various services. When I was working in the UK, organizations such as the National AIDS Trust, Trans Trust, the Food Chain, Africa HIV Policy Network, iBase. I mean, these are sort of like, organizations that were run by individuals, and some were more were bigger, but the passion for that the people that work in those organizations had for their cause, which was basically a life and death for many people in the early years, and then also stretched to sort of like more complex issues around stigma and the role in society, and how we actually sort of like approached the HIV pandemic was incredible, and for me it was life-changing in terms of being able to understand why this is so important and relate to other areas of care going forward.
Wonderful, wonderful. I appreciate you sharing that intro. And I listening to that, and then thinking a little bit about your mission now, and looking at the MSD for Mothers sort of mission statement, helping to address one of the most preventable global health tragedies out there, where no woman has to die while giving life. And then, I go over, in preparation for our discussion today, I'm looking at this World Health Organization data. This is 2018 data, but it's rather shocking that we still have 300,000 women dying around the world in pregnancy and childbirth, about 95% of those in low resource settings, and things like bleeding, infections, high blood pressure. These are things that should and could be prevented. Could you walk through just a little bit of MSD for Mothers and introducing sort of the organization, the strategy in maternal mortality? And then I noticed that it is part of the broader corporate responsibility portfolio, which falls under this access to care, which includes a wide range of initiatives like neglected tropical diseases, diversity in clinical trial design, everything you're doing with the Ebola vaccine and things of that nature. Talk a little bit about the broader MSD corporate responsibility portfolio, if you would.
Employee as well. You've done a great job in terms of summing up some of the stuff that we're doing. But as you mentioned, actually, one of the greatest tragedy of the mission that we're trying to address from an MSD for Mothers perspective is that a lot of the deaths are preventable. When you look at a country where I come from, in terms of Nigeria, and the maternal mortality ratio in Nigeria, and compare it to where I'm sitting right now in Switzerland, it's just night and day. And you rarely have maternal mortality in a place like Switzerland or the UK, where I spent most of my early years of my life. But in Nigeria, it's just so common. I often think about, literally every time I go back, people have a story. Everyone has a story to tell about someone that was touched by this. And the fact that it's preventable is even more shocking. So, I mean, from an MSD for Mothers point of view, we're trying to change that. We're trying to create a world where no woman has to die given life. It's been a mission that we've been on for the last 10 years. I think that the strength of this initiative is that we're not only committing financial resources to this, but also bringing MSD's business and scientific resources to try to help to address this issue, and in the process of that, help the world move towards the Sustainable Development Goals for reducing maternal mortality, which is reducing maternal mortality by 70 deaths per 100,000 live births. Like I said, we're trying to bring our business acumen to the table. And strategically, one area we actually identified as being most pertinent and where we can actually play a significant role is leveraging the wider capacity of private sector to help augment the capacity to respond to maternal mortality. And we do this by collaborating with a diverse group of stakeholders to achieve this. Ultimately, also, we're trying to strengthen health systems long-term so that we do this in a sustainable manner rather than necessarily creating an intervention that is short-lived. And I would say the development community, historically, we've been kind of guilty in some respects of creating solutions that are short-term lived, and we don't think enough about sustainability. But we try to build sustainability right from the start. And that's also part of the reasons why we think about private sector interventions and what the capacity the private sector can bring to the table, because the model in which private sector often uses is one that basically builds in the financial aspect in terms of how do we actually ensure that whatever intervention that is being put forward is financially viable long term. And I think that's an important element that we seldom talk about, but we do really need to think about. But to date, I'm proud to say that the MSD for Mothers initiative has reached 13.1 million women, enabling them to have healthier pregnancies and safer deliveries. Made over 100 strategic investments and reached about 78 million people through improved care. So it's making a difference. But I think one of the things that I'm so proud of is the fact that we're also trying to make a paradigm shift in terms of how the global health community thinks about the sustainability of these interventions that we all make in terms of across the board. From a wider MSD perspective, we're committed to high level of environmental, social, and governance performance, which stretches many decades. You mentioned the Merck Design Donation Program, but also beyond that in terms of how we actually operate in terms of expanding access to health more broadly, but also developing and rewarding diversity within our company and having a healthy workforce. We're also very deliberate in terms of protecting the environment, as well as operating at a higher standard in terms of ethics and value. So these are four focus areas. We continue to challenge ourselves, to innovate, and to make ambitious commitments in these areas. I know the MSD for Mothers initiative, the Merck Design Donation programs are good examples of that. And Merck has and MSD has a legacy of these kind of commitments.
And it's talking about sort of the sustainability, and then really what you term the resiliency moving forward in the future. You have this. You recently authored this article. It was in DevX. It was called "Private Sector Universal Healthcare and Maternal Mortality Amid COVID-19." And here you talk about some of these challenges, as you're mentioning: not enough healthcare workers, not enough supplies, this huge financing gap. And then you talk about this, the World Health Organization did this report, engaging the private health service delivery sector through governance in mixed healthcare systems. Talk a little bit of what that means. And also if you could sort of introduce, because I'm less familiar with some of the Sustainable Development Goals, but this UN Sustainable Development Goal number 17, strengthening the means of implementation and revitalization of the Global Partnership for Sustainable Development, which brings a lot of this, it's sort of, a lot of this stuff gets connected at the end of the day. Talk a little bit about some of the points you were getting across in this important paper.
Yeah, so, to begin? Perhaps, to focus in terms of, what the pandemic has perhaps surfaced, which I was trying to put across in the article, which was, we've had a weak health system for a pretty long while, but not least in low middle income settings where the fragility of the health system and the weaknesses are lived by many on a day-to-day basis. It's probably in, so like when we think about the more developed society economies across the world, we don't feel it on a regular basis. But even in those settings, the pandemic has really tested the system, as you well know. But in a lot of low to middle income settings, this is a day-to-day occurrence, and the solutions to the challenges that have been surfaced, such as lack of access to healthcare workers, lack of ability of consumers or clients to be able to actually get to the services that they need, basic access to commodities, all those types of things are a regular occurrence for many people. And the solutions that we seldom lean into is the capacity that are there locally that include local private providers, for example, or private sector more broadly, where the private sector in places like Nigeria, again, where I come from, in a state like Lagos, 70% of care for reproductive health are delivered by local private providers, but they're not strategically integrated into the health system more broadly. It's understood that they are playing a role, but that capacity isn't necessarily brought in a unified way to say, okay, look, we can actually leverage these guys to deliver services, especially in hard to reach communities. One of the things that basically the pandemic has shown us that basically, we have no option in terms of what to actually do so. An example I often use related to that is when you look at the beginning of the pandemic in, again, Nigeria, where we had only 2 functioning laboratories across the country that basically were able to provide the COVID testing, but we needed to wrap up very quickly. Now, the financial resources, expertise for government to be able to do that immediately or spontaneously is pretty limited. But we had private laboratories that were capable to be scaled up or strengthened to be able to actually ensure that we have wider coverage across all the 6 geopolitical zones in the country. That was the quickest way, the most cost-effective way to be able to achieve that goal. But that's one example. We have similar instances where, from a reproductive health point of view, we have women wanting to access modern contraception, and they don't have immediate access to services. But we know that there are community pharmacists, private medical vendors that are capable of reaching those communities that you don't have a formal pharmacist on their doorstep, and strategically, we can actually leverage their capacity to be able to get those commodities to women. And so we're partnering, related to that, we're partnering with Bill and Melinda Gates Foundation and Society for Family Health in Nigeria through a project called Integrate E, where we're training community pharmacists and patient proprietary medical vendors to be able to provide screening quality and be quality assured, so that they can, one, understand the needs of their clients and someone that's speaking to them, refer them should the need be, but also be able to actually offer a broad basket of contraception should they be required. And we know in places like, again, like Nigeria, access to modern contraception can be a real challenge. In some settings, it's the unmet need for modern contraception is huge. So these are some of the realities we need to be able to lean into to address some of the gaps. And when we think more broadly from a global point of view or regional point of view, the Global Finance Facility says we have something like a $33 billion annual deficit in financing for reproductive, newborn, child, and adolescent health alone. That's only been exacerbated by the pandemic, given the amount of resources that needed to be shifted towards addressing that immediate need. So the challenge keeps on getting bigger, and to think that government has the capacity to be able to respond to that financial gap and build on top of it by itself, I think is not realistic. Especially, and it's not efficient either, given that basically you have potential capacity within the private sector that can help you bridge some of those gaps. And in terms of investment, they obviously offsetting some of the initial investment that that needs to be made. On top of which, when you actually look at the business model of health from a service delivery point of view, in a lot of instances, there is a challenge in terms of the model of someone walking through the door and one by one for a lot of the service providers to be able to actually have a viable, business model to actually keep providing the service that they need from a quality point of view. What some of the states we're seeing, in not just in Nigeria but in other geographies are doing, is commissioning local private providers to provide care for a certain community, and ensuring that basically they're quality assured, and understanding what the budget envelope for that care package is. And through digital technology, you're actually able to also be able to track all that process in a very concrete way. So I think these are some of the things that the reality is we actually need to start leaning into. If we need to bridge that gap that exists, both in terms of funding, but also in terms of actually, most importantly, the delivery of care to people that need it on the front line.
Excellent. And Tayo, you just mentioned digital technologies, and I know that you recently gave a talk at the Africa Health Agenda International Conference, and your talk was entitled "Technology and Digital Platforms for Universal Healthcare." And you point out here, in lieu of all these shortages of providers and supplies and so forth, innovation is coming to the rescue on many fronts. And we see a lot of that obviously during the pandemic in terms of surveillance, contact tracing, and so forth. Talk about some of the innovations, the technologies that get you most excited, that the MSD for Mothers is very excited about, in terms of some of these new tools that are helping, sort of, as you say in this presentation, on the abstract, leapfrogging the process forward a lot on the continent and elsewhere, not just Africa.
So the two technologies that I think we're most, or at least I'm most excited about. One is a platform called MomCare. It's not necessarily very new, but I think it's has the opportunity to transform care for mothers. This is an initiative in collaboration with Farm Access Foundation. was upon this platform, which is a digital platform that helps women track their maternal health journey, improving their ability to complete the full continuum of healthcare visits, and help them assure that their pregnancy is safe. Now, this platform also enables women to be able to save towards their care as well, should they need to, and also linked to an insurance, a potential insurance scheme, whereby you can actually have access to a healthcare insurance that covers your full pregnancy journey, which is an important way to be able to assure that you can actually get access to the care should you need it. But what mom care does is that women can track their maternal health journey, which is an important process, and also they also can have ownership in terms of an understanding of their care. Providers can improve the quality of care that they're providing, because it offers and tracks the intervention and the journey of the woman through a pregnancy. And they're also connected to the woman electronically, so that they can pass information to her, and likewise she can pass information back. And also I think one element that is often underappreciated is the ability for women to also provide feedback into the system to help improve the system as a quality improvement process. Very often people think, oh, it's just this is feedback to try and either bash us or say all the things that are wrong with the service, but actually it's an important feedback loop for those that are providing the service to be able to actually understand the consumer perspective in terms of their experience of the service that you're providing. That can really help in terms of ensuring that the next time someone walks in, their experience is better. We do in other walks of life, and on health, which is so critical, especially in terms of maternal health, when you're talking about the safe delivery of a child and the health of the mother. This has to be such an important element to ensure that basically we keep on improving this important part of care. So mom care, I think, is exciting from that perspective. It's currently being used in Kenya and just in Nigeria, and we would hope that basically it's something that we can actually really extend beyond those geographies. The other is Nivi, which is a mobile platform, mobile phone-based platform that serves, that was developed in Kenya, that serves to connect what we thought initially were women to access family planning commodities and where they can access services. But as the project rolled out, what we found is that basically actually a lot of men were accessing services to actually understand the options in terms of contraception, and find out generally about reproductive health. So I've gotten the percentage in terms of the actual number of men versus women on the platform, but it's significant, which basically shows there's a need out there for both men and women to understand family planning services. And what Nivi does is not only educate those that are engaged on the platform, but it then refers you to a facility where you can get the kind of service that is most tailored to your need, and allow you to have a quality assured service in the environment. This is also very important for young people, where we know that there's a challenge in some geographies of for less youth-friendly services, where the young people may feel discriminated against. This can help in terms of actually ensuring that basically where they go to have youth-friendly services. This is currently, as I said, it was launched in Kenya, in Nairobi, but we're also launching this platform in India as well as in Nigeria. And going back to one of the things that the COVID pandemic is teaching us is the versatility of platforms such as this, and being digitally being a digital platform, we can pivot to be able to address different needs. So during the beginning of the pandemic, we've seen that basically this platform has been able to respond to people's concerns around the COVID-19 pandemic, which has been, immensely valuable.
And just, I was wondering as I was, those are fascinating next generation tools, which, I think it's amazing that you're working on them and getting them out there. But then when it comes to, coming back to that list that, I mentioned at the beginning when we were chatting about maternal mortality in general, things like bleeding and infections, it seems like not your, or it seems like somewhere along the way, like some of those things should have been taken care of by now. And it just, obviously I'm sitting here and on the East Coast of the United States, and obviously we don't have those numbers like in other parts of the world, but non-technological programs and interventions, whether they're Merck or other, maybe other organizations that you've been involved with in the past, what does it take to sort of clean up some of these other, it seems like, needs that we should have addressed in the year 2021, that blood pressure and bleeding and infection should not be the reason why so many mothers are dying?
You're totally right. And one of the things that I'm most excited about in terms of the work that we're currently doing is a partnership actually with White Ribbon Alliance called the What Women Want campaign.
Okay.
And this campaign was initially launched 2 years ago now, which surveyed over 1.2 million women across the globe to understand what their top priorities are for maternal reproductive health services. Based on this input, we've already seen resources and policies change. The reality is there is a disconnect, as the survey found, between what we understand, or many understand, as the priorities for delivering quality care versus what women were saying is their top priority and the reasons why they're, having challenges in terms of whether accessing care or when they get to the facility receiving quality care. So one of the top priorities around dignified care, respectful dignified care being number one priority, water and sanitation being another. And we take these things for granted.
Sure.
But what that translates to, for example, again, in a place like Nigeria and other many other LMICs, is that we have more people giving birth outside the facilities than in the facilities. And we know that basically if you have skilled birth attendants at a delivery, the mother's more likely to survive and the baby also to be okay. But when we have the majority of people not going to facilities because they believe that the quality of the care that they're going to get is not what they would expect, then you have a challenge, because it doesn't matter how big shiny the building may be, but if the experience is not good, and as I said, in terms of respectful, being able to have a dignified experience at the facility, why would you go there? Right. So this is some of the fundamentals that I think, it seems soft, but are so critical in terms of us understanding how to address some of the challenge. And to your point, when you don't have access to some essential commodities is another. And we're flagging that as an issue, or in settings where they have to go and buy their own. They're not doctors or nurses, or you're expected to bring some of these commodities to the facility yourself. It's, these are challenges. And what the What Women Want campaign demonstrated is that there are these fundamental issues that we need to start taking seriously and addressing. And to be commended, in different geographies where this campaign was run, the government's actually responding very very strongly. I think about Niger State in Nigeria, where, as you know, I said, water sanitation is a major factor as a result of the health commissioner and leadership within the government. Hearing the result from the survey, and the women actually saw, like, telling the government directly that basically these are their challenges. They've introduced a policy where every healthcare facility, primary healthcare facility, has to have at least 6 functioning toilets and running water within them. Which you would expect would be very, very helpful. But also, actually, in terms of the national policy, that's also actually been adopted as a national policy as well. Also, within the state, there were only, I forgot the exact number, but there were very few midwives across the whole state.
Yeah.
The government committed and is in the process of actually recruiting more midwives across the state. We've seen similar responses in India, where the budget in different states, where the budget for reproductive health services has been significantly increased. So this shows that basically this is possible when we actually can leverage the voices of women to in a strategic way for policy change. And one of the things that we're also working with White Women Alliance around is helping to create a digital platform by which we can do this more systematically. So the original campaign was run to their credit in a very analog fashion, I would put it, where they had volunteers, both men and women, going to communities, taking interviews, to be able to capture the voices from different communities across the geographies where the campaign were run. But obviously, as you can imagine, that's very labor intensive. From a replication point of view, it's quite challenging. It's expensive in some respect. So in partnership with PMNCH Foundation, we're developing a digital platform where we can repeat campaigns across multiple geographies in different languages, where we can be able to capture the perspectives, the voice of women in those settings about their priorities, about different issues, and be able to then present this in a systematic way to policymakers and other decision makers.
Outstanding. Tayo, I mentioned, we talked a little about you were at the African Health Agenda Conference. You participate in the World Economic Forum, talking about these topics. What's coming up for you specifically in 2022 as far as MSD for Mothers, conferences you're going to be at, presentations you're going to be giving? What's happening over the next several months where we can follow you and your initiatives?
So we've just launched a really exciting initiative that speaks to all this that we've just been discussing, which is the Strengthening Systems for Safer Childbirth initiative.
Okay.
And this is in response to the fact that progress is still really slow in terms of meeting the maternal mortality reduction targets for the SDGs. So across Africa, for us to be able to actually or to make this target, we need to double efforts, and Africa will not make the target at a current rate of progress until 2085. So okay, we're behind, and we need to see how we can actually help accelerate that. So in response to that, we're launching this initiative where we're committing what seems might seem to some a small fund looking at the global challenge, where we provide catalytic fund to leverage local capacity in response to needs in different geographies, with a focus on Nigeria, Kenya, and India. Okay. That being our focal countries because of the high rate of maternal mortality burden in these geographies. And as part of that process, as I was just saying, one of the critical factors we want to see is this being informed and led by the priorities that women in those geographies are elevating as the issues, and being able to sort of do this in collaboration with others within that geography to be able to respond to this. Goes back to what I was saying earlier on about sustainability.
Yep.
For these initiatives to be sustainable, they can't be siloed initiatives. They need to be integrated into what is currently happening on ground. So from that perspective, we sent out an expression of interest during the UN General Assembly meetings, and we're expecting responses back until November the 15th of this month, and for the next few months into next year, we'll be looking at those expressions of interest and identifying some of those game-changing initiatives that can help us in terms of, or help the communities to be able to respond to the challenges and hopefully address them, as well as trying to bring in other partners to help address these issues.
So, Tayo, you have had an amazing career. You have worked in some of the world's largest companies. You've worked with major non-governmental organizations, obviously in academia, and no doubt met a wide range of fascinating people across these domains. Talk a little bit about some of the mentors, the influencers that have been around along your journey, that have been really instrumental, that if it wasn't for them, Tayo Erogbogbo would be doing something totally different at this point in time.
No, thank you. Great question, and I think it's a very important
point. I already mentioned my father, but I've been blessed by so many different people that have touched my life more broadly to different degrees as mentors. In the early years, there were a number of teachers that I would that took on that role. I'm not sure whether they necessarily realized or volunteered for it, but that's what they did. They did. I think of my late coach when I was at secondary school, Mike Dawson, and another Steve Smith, who spent a lot of their time actually nurturing my early interest in athletics, as well as old school chaplain, art teachers, who again nurtured my interest in art. So I mentioned that because when you're growing up, you don't necessarily realize how important some of these connections are. But I lean into some of the advice and some of the time that they spent with me in terms of nurturing my interest in these areas now. And I try to tell my son the same in terms of when he's engaging with some of his teachers to be slightly more attentive than maybe he would otherwise be. But professionally, there were a few people that I think made a marked impression on my career. One was actually a senior leader within at Abbott, a guy called David Forrest. I was a general manager at the time when I was the UK business, and then he went on to lead the global nutrition business for Abbott. But I remember going to his office after persuading him that he needed to spend some time with one of his leading sales representatives, which he did. And I prepared a huge presentation saying to him, look, David, these are all the things I want to do with the company, and this is how we could do different things differently, and this is my role and all the stuff. And to my shock, when I finished all this wonderful presentation, he said, all very good, Tayo, really interesting, but I'm more interested in Tayo the person and what makes you tick and what do you actually want to do. And I was like, really? I thought you'd be interested in how am I going to make the business better? And it was like, no. So when you're sitting back on your rocking chair and you think, okay, what have you actually done with your life? I want to understand, that Tayo and what is it that you actually want to do. And that was a real game-changing moment for me in terms of trying to decide what I want to spend the rest of my life doing. And I had some inclinations. I knew I was interested in, at the time, in global health and in development more broadly. But I hadn't really thought about it in that sense, in terms of, okay, look, what does it actually mean? Is it just a job, or is it something that you're actually, devoting your time and effort, life to. So that was a very moment. And then I have a number of different stakeholders that I was, or individuals that I was also, so I, mentioned that I think had profound impact at different moments in my life. Another being a friend and a mentor called Rupert Davis, who actually introduced me to development within the health sector when he volunteered me to be part of the Global AIDS Care program. And having been exposed to some of that, I was like, okay, well, this is what I really wanted to do, understanding a bit more about global policy and health policy and issues around advocacy. So yeah, I think it's an important part of growing up as an individual and your professional career. And a number of folks that I also still lean into as a relatively young Black person is a gentleman called Tokes Kanoshi, who was again another leader within the pharmaceutical industry, who has held a number of different positions in the industry and a senior person that I think offers me some dimensions to growing up as a young Black professional. My current boss, not just because she's my boss, which is probably quite good strategic comment, but no, it has been really incredible. I'm one of the people that I often lean into for advice. But all in all, I think one thing that I would say is important to have a broad network of people that you can tap into for advice, but also to be the same for others. As I grow up, I think you sometimes underappreciate some of the things that you can offer to others, but being there to actually be able to offer that, I think, or being open to be able to offer that is very important.
Very important message. The mentee becoming the mentor. Great message. Really great. Teo, while I have you, I know this is gonna transition over to a sort of separate topic, but I really like to hear a couple of minutes about it. So I have very limited athletic skills, but I do enjoy watching the Olympics. I watch boxing, I watch Olympic weightlifting, and I do watch track and field. And when I do watch track and field, I'm always amazed, whether it's the pole vault or the high jump, or in your case, the triple jump, how that athlete decided to pick that particular sport. And I would love to hear just a couple of minutes of when triple jumping, when did you decide, hey, triple jumping is my thing, and I'm going to be a medalist in this particular activity?
Really funny. So it was at school in Nigeria. I think I was age 9. Sports day was coming around the corner, and I saw some folks in the courtyard doing this thing. And I was like, what are you doing? I just thought it was like kind of a game. And like, oh, triple jump. And, we have sports day coming up very shortly. And the guy that was, practicing was representing my house for triple jump. So I watched that when sports day came around. And then I went over to the UK to study. I was like, I need to try that triple jump thing. When the summer came along, and so I did, and I thought, oh, this is pretty good, and also happened that I was apparently quite good at it, and I kept on doing it. It was just, I think, just something just stuck in my head about it. But I used to obviously sprint a bit as well. Some of my friends would laugh at that because they're actual sprinters versus a triple jumper running. But yeah, it was just one of those things that stuck. But I was, it's been an incredible journey. When I was obviously doing it, spending 10 years plus as a professional athlete, and as you can imagine, it leaves an indelible mark on your life. Your life is dedicated to that. You're in every aspects, in terms of when you sleep, when you eat, what you eat, where you go,
right.
Et cetera. So it was really incredible. And so one of my biggest most important takeaways, certainly from an international point of view, is, or at least competing at that level, is just the importance of focus.
Oh yeah.
I always remember my coach, always questioning, as we all do, as sometimes an athlete, you venture off and wanting to do different exercises or do different deals because you think you need it, and you're like, okay, so please tell me about that. How does that help you achieve your goal? So how's this going to make you jump further? And then you sit back and you think, So by the end of it, my whole course as an athlete, it was like that question, though, in terms of, why are you doing this, always stuck into my mind, and something I take into my current career and life generally, in terms of, why are you actually doing this, and how does this actually contribute towards your goal? And if it doesn't, should you be doing it? But it's a great journey, and I think sports is a good way for anyone to discover themselves and learn about life. I tell my son the same thing.
That's outstanding. It's extremely impressive. That's why I just wanted to bring it up. Aside from everything you're doing at Merck, which is equally impressive, but it's been a fascinating journey, Tayo. And it's been fascinating listening to you talk about this, and really wishing you and the whole team there the best, moving all these programs forward, because they're so important, and they're really still very much needed moving forward in 2022 and beyond. And for everybody that is going to be listening to this particular episode across the podcast networks, or watching on our YouTube channel, you've been listening to Tayo Erogbogbo, Global Advocacy Director, MSD for Mothers, Merck Sharp and Dohme outside the U.S., Merck here in the U.S. and Canada. Tayo, it was great seeing you. I want to thank you for taking the time out of your schedule to talk to us. Thanks for everything you're doing there, and for all the mothers all around the world. And as we say on this show, thank you for helping to create a better tomorrow for everybody. A really fascinating journey.
Thank you very much. It's a great pleasure to be here.
On behalf of the team, we have an incredible team. It'd be incredible. I sometimes pitch myself in terms of both the leadership as well as my colleagues that I work with every day, that wake up every day to do this work, and the company that actually allows us to respond to this. It's a pleasure to be here, and we look forward to working with you and all others to change the world in a more positive way.
Outstanding. Great having you.